Borderline personality disorder is a mental illness characterized by extreme emotional instability, impulsivity, and a deeply rooted fear of abandonment. The emotional life of a person with borderline resembles a constant state of crisis, caught between the longing for closeness and the panic that this closeness will bring pain. Relationships become a survival struggle for an identity that lacks a stable foundation. Identity is unstable and fragmented. One moment, a person with borderline may feel confident and loved, only to plunge into despair, emptiness, and self-rejection shortly after. Mood swings are rapid and extreme, often triggered by seemingly insignificant events. Even the smallest sense of rejection can unleash a flood of emotions and behaviors aimed at keeping the other person close, sometimes dramatically, sometimes destructively. Impulsivity spans many areas, from sudden outbursts of anger to risky behavior, substance abuse, casual sex, self-harm, and even suicide attempts. Emotions are not expressed, they explode. Life with borderline is like a ride without brakes on a winding road, where every turn can end in disaster. This disorder is often mistakenly seen as hypersensitivity or an unstable personality. At its core, however, lies a chronic sense of emptiness, a lack of a stable sense of self, and the inability to build safe, predictable relationships. Every attachment is a potential threat, and at the same time, the only hope for relief from the inner chaos. The roots of borderline personality often trace back to childhood marked by rejection, emotional neglect, or an unpredictable environment. When love was conditional and safety unstable, the psyche developed survival strategies that, in adulthood, become a source of suffering. A person with borderline cannot be alone, yet the presence of others is equally frightening. Every closeness hurts, every solitude destroys. The emotions are too intense, the world too sharp, and relationships too fragile to be a place of comfort. A relationship with a person who has borderline personality disorder is an intense and demanding experience, full of extreme emotions and unpredictable turns. At first, it can be captivating, warmth, passion, and a sense of extraordinary closeness. But tensions and conflicts quickly emerge, often triggered by fear of rejection or abandonment. A person with borderline frequently oscillates between idealizing their partner and devaluing them. One day, you are the hero the world needs. The next, the source of disappointment and pain. These fluctuations create emotional chaos that is difficult for both partners to endure. Attempts to seek closeness can manifest as clinginess, jealousy, or even manipulation, not out of calculation, but stemming from deep fear and desperation. Boundaries in the relationship are often unclear or suddenly shifted. A person with borderline may struggle to accept the other's independence, which can lead to conflict and a feeling of suffocation. Moments of distance are interpreted as signs of an impending breakup, provoking impulsive reactions. Despite these challenges, relationships with someone who has borderline are not devoid of depth and authenticity. Behind the facade of emotional turmoil lies a profound need for love, understanding, and security. For such a relationship to last, it requires the partner to have a great deal of patience, emotional stability, and a willingness to build trust continuously. Without that, it's easy to fall into a vicious cycle of conflict, blame, and pain. The diagnosis of borderline personality disorder is based on a detailed clinical assessment that includes the analysis of symptoms, life history, and the patient's emotional and social functioning. A central diagnostic tool is the DSM-5 classification, according to which a person must exhibit at least 5 of the following criteria to be diagnosed with borderline: intense fear of abandonment and efforts to avoid real or imagined abandonment, a pattern of unstable and intense interpersonal relationships characterized by alternating between idealization and devaluation of others, identity disturbances, marked and persistent instability in self-image or sense of self, impulsivity in at least 2 areas that are potentially self-damaging, e.g. spending, sex, substance abuse, reckless driving, recurrent suicidal behavior, gestures or threats, or self-harming behavior, affective instability due to a marked reactivity of mood, e.g. episodes of dysphoria, irritability, or anxiety, usually lasting a few hours and rarely more than a few days, Chronic feelings of emptiness. Inappropriate, intense anger or difficulty controlling anger. Transient, stress-related paranoid ideation or severe dissociative symptoms. The diagnosis requires ruling out other mental disorders that might present with similar symptoms and taking into account the patient's life context. A comprehensive approach is essential. Interviews, discussions with family members, and observation of the patient's daily life. An accurate diagnosis forms the foundation for planning effective therapy and support. Examples of individuals with borderline personality disorder illustrate characteristic behavior patterns that manifest in everyday situations. Although their behavior is often difficult for others to understand, it frequently stems from a deep fear of abandonment and emotional instability. 1. A person who becomes intensely involved in relationships. In the early stages of a relationship, they show intense attachment and idealize their partner, almost viewing them as perfect. But even minor misunderstandings or delays in response trigger panic and a sense of abandonment. In reaction, they may display intense emotions, ranging from anger to despair, that can take the other person by surprise. Threats of breaking up are often used to force closeness or emotional reassurance. 2. A person with self-destructive impulses. In moments of intense emotional pressure, they resort to self-harm or other risky behaviors that offer temporary relief from their inner chaos. While this behavior is distressing for those around them, it serves as a way for the person to cope with the overwhelming sense of emptiness and pain that is difficult to articulate. 3. A person with extreme mood swings. Within hours, they can shift from euphoria and enthusiasm to deep sadness and hopelessness. These intense emotional roller coasters affect their ability to make decisions and maintain stable relationships. To others, they may appear unpredictable and difficult, which only reinforces their sense of isolation. A person who constantly feels inner emptiness. Despite numerous attempts to fill this emptiness, through intense relationships, substances, or extreme experiences, the void remains. They often describe themselves as lost, insecure, indecisive, lacking self-worth, and a stable identity. These examples show how people with borderline function in everyday life, constantly balancing between the desire for closeness and the fear of it, between intense emotions and emptiness, while often struggling to find equilibrium within the chaos of their inner world. Therapy for individuals with borderline personality disorder is a process that requires patience, understanding, and appropriate tools to help build emotional stability and improve functioning in relationships. The most effective methods focus on emotional regulation, developing self-awareness, and strengthening the ability to cope with impulsivity and stress. Dialectical behavior therapy, DBT, is one of the most well-documented treatment approaches. It combines cognitive behavioral techniques with mindfulness and acceptance. DBT helps individuals with borderline identify and regulate intense emotions, reduce self-destructive behaviors, and build healthier interpersonal relationships. Other effective approaches include schema therapy, which targets deeply ingrained thought and behavior patterns, and mentalization-based therapy, which enhances the ability to understand oneself and others. Support for family members and close loved ones is an essential part of the healing process. Relatives often struggle with emotional exhaustion, frustration, and a sense of helplessness. Psychoeducation provides them with knowledge about the mechanisms of the disorder and teaches communication based on empathy and healthy boundaries. Support groups for families help in sharing experiences and reducing feelings of isolation. Treatment for borderline personality disorder is a journey that can lead to significant improvements in quality of life. Although there are difficult moments, consistent therapy and proper support enable many individuals to achieve greater stability, build healthier relationships, and develop a stronger sense of self-worth. Patience, consistency, and belief in the possibility of change are crucial. Does a person with borderline personality disorder really want to hurt their loved ones? No. Hurtful behavior stems from intense fear of abandonment and a lack of emotional regulation skills. It is a way of expressing pain, not an intentional act of harm. The behavior is a reaction to suffering, not an attempt at manipulation or control. Why are the emotions of a person with borderline so intense and changeable? Their nervous system is highly reactive. Even small situations can trigger an emotional storm. Emotions arise suddenly and with great intensity, and the ability to control them is limited. It's not a conscious choice, but a neurobiological symptom of the disorder. Can a person with borderline love faithfully and long-term? Yes. Their feelings are deep and genuine, even if often expressed in chaotic and impulsive ways. The need for closeness is strong, but it is accompanied by fear that this closeness will cause pain. Lasting love is possible, but it requires mutual understanding and stable support. Does therapy really help people with borderline? Yes. Properly tailored and consistently applied therapy, especially dialectical behavior therapy, DBT, effectively supports the development of emotional skills and improves quality of life. Over time, it reduces impulsivity, strengthens relationships, and builds a more stable sense of identity. Do loved ones of someone with borderline have to give up their own lives? No. Helping does not mean self-sacrifice. Healthy boundaries, self-awareness, and outside support are essential. Loved ones need space to care for themselves, but can still be a vital support in the healing process, without losing their own balance. Borderline personality disorder is an intense inner world where emotions have no boundaries and relationships become a battleground between closeness and the fear of abandonment. Identity instability, impulsivity, and a deep need for love create a mix that turns life with borderline into a constant balancing act between hope and despair. Despite extreme behaviors and difficulties in relationships, this disorder does not rule out the possibility of change. The diagnosis opens the door to therapy, and when therapy is consistent and tailored to the individual, it can bring genuine relief. The greatest challenge, but also the greatest opportunity, is shared understanding, both from the person affected and their loved ones. It is empathy, education, and presence that create the space in which a new way of living can be learned. The goal is not to eliminate suffering entirely, but to learn how to live with it, without destruction, without isolation, without fear. That is the power of therapy and the strength of relationships grounded in truth and acceptance.